English test. Listening test. This test has two parts. Part A. In this part of the test, you will hear a dentist talking to Fiona, a woman with discoloured and chipped teeth. You will hear the consultation once only in sections. As you listen, you must make notes about the consultation under the headings given on the answer paper. Turn over now and look quickly through Part A. You have 1 minute to do this. You must give as much relevant information as you can under each of the headings provided. You may write as you listen, and there will be pauses during the consultation for you to complete your notes under the relevant heading and to read the following heading. There will also be 2 minutes at the end of the test for you to check your answers. Give your answers in note form. Don't waste time writing full sentences. Remember, you will hear the consultation once only, and you should write as you listen. Now look at question 1. Question 1 has been done for you. Hi, please come in and have a seat. My name's Daniel Jones and I'll be your dentist today. May I have your name, please?
Hi, doctor. My name is Fiona.
It's lovely to meet you, Fiona. So tell me, what's brought you in here this morning?
Well, I have some discolored teeth that I found a little embarrassing, to be honest. They are a little dark yellow and kind of like a rusty color in some areas, sort of stained. I've also had people making some comments about them recently too.
Now look at question 2. Take notes on Fiona's additional concerns. Well, that's no good. I mean, people making comments about them. But discoloration is very common, actually. It's certainly nothing to be embarrassed about. So, apart from the staining, is there anything else that's bothering you?
Yeah, I also have a chipped tooth at the side just there, so it doesn't make for a very attractive smile sometimes, you know?
Okay, so does that usually sort of stop you from smiling at all?
Yeah, I guess it does. I don't particularly like opening my mouth at all, to be honest. But the main issue is I'm starting a new job in 3 weeks, and it will involve a lot of chatting with customers face to face, so I'm a bit worried.
So you're hoping to have a new smile for the customers. Well, that's perfectly understandable, I think.
Yeah, well, because I work in customer service, I think first impressions are everything. It's a really important part of the position, so I need to look at my absolute best. I don't want customers staring at me.
Okay. And is there anything else worrying you at the moment? I mean, apart from what you've already mentioned?
Yeah, I suppose I'm also worried about if it smells. If I smell, bad breath and stuff, I just don't know if the stains affect my breath. But also, I should be honest with you. I can't really afford to pay for very expensive treatment right now either. As I said, I don't begin for another 3 weeks.
Now look at question 3. Take notes on Fiona's lifestyle habits. Well, discoloration doesn't usually cause halitosis, or bad breath as you say. Any type of bad breath is usually related to sort of lifestyle habits, or in some cases it can be related to gum disease. But let's just start by having a quick look inside, okay?
Okay.
Okay, so from what I can see here, there's definitely some discoloration, mainly in the front here and towards the back. Your gums look very healthy actually, and I have to say that I can't personally smell anything nasty. I can smell one thing, and I'll clarify that in a moment. The chip is actually not too severe either, which is good news. So let's just begin with the discoloration. I'd like to ask you a couple of questions just to clarify a few things, okay?
Sure.
So I'm going to say that you're a smoker. Am I right about that?
Yeah, I've been smoking now for about 9 years.
And how many cigarettes would you average per day, do you think?
Probably between about 10 to 12 per day. When I was working, it was a little less, but these days I have far more time on my hands, so I tend to smoke a little more.
Okay. And do you drink coffee or tea? Because I can actually see quite a substantial amount of staining here.
Yeah, I drink coffee, probably about 4 cups per day.
Now look at question 4. Take notes on Fiona's attempts at quitting and the dentist's advice. So Fiona, there are some obvious suggestions I'm going to make. Now it's entirely up to you, and I know that they might be somewhat difficult in the early stages.
I think I can guess what your advice might be.
Yeah, I think you probably can, but I'm going to go over a few things anyway. Have you tried or ever been interested in quitting?
I've tried patches, which I didn't like at all because they affected my sleep. I've also tried going cold turkey, but that was impossible. But with going cold turkey, I actually lasted longer than with the patches, so I guess my willpower isn't too bad.
So you would like to quit then?
Yeah, I'd love to, yeah.
Okay. Have you tried just simply reducing the amount of cigarettes you have? That's probably the only surefire way that I've ever seen work. It takes a little longer just because you're only reducing the amount of a few cigarettes per week. But by the time people get to 3 or 4, they usually don't have that craving like before. And as you said, your willpower is strong, so perhaps that would be a very good method for you.
Yeah, I can definitely give it a go. I had no idea that cigarettes could stain my teeth so much.
Well, the next bad news is that it's also the coffee. So I'd like to suggest the same path with that too. Simply reduce the amount you drink each day. It also helps just to swish some water around your mouth after drinking it too. But the best method is to brush your teeth. How often do you actually brush?
Just once in the morning.
Okay. Ideally, you want to brush gently twice per day. Don't brush too hard. And actually, brushing at night before bed is much more important than in the morning. So I'd highly recommend you start that.
Sure, I can manage that.
Now look at question 5. You will hear a discussion about the possible treatment options. First, take notes on the dentist's recommendations. So the next step is to discuss your treatment options. You said that you're on a limited budget, but unfortunately there are very few dental procedures that I would call inexpensive. There are a number of options though, but they all involve you minimizing any bad habits, because if you continue to smoke, then the staining is more than likely to return. So it is possible to whiten your teeth with a whitening agent, and you can do that both here and also you can do it yourself at home. You can actually do a combination of both, and that involves a kind of bleaching. But that won't actually fix the chipped tooth, of course. So the best option, in my opinion, would be a porcelain veneer, which is a kind of sort of a wafer-thin, custom-made kind of shell for the teeth. Now, take notes on the dentist's description of the fitting process. So what we do there is take an impression of your teeth, and this is then sent to a dental laboratory where the veneer is actually made. I'd scrape off a microscopic layer of enamel. Once the veneer is back, I'd shape it and then cement it into place. Now look at question 6. You will hear an overview of the recommended treatment. First, take notes on the advantages.
That sounds like a lot of work.
Look, what I'll do is give you an overview of both the positive and the negative, and we can make a decision based on that, okay?
Yeah, that'd be good.
It can be some work, as you said, but with veneers, the likelihood of a more aesthetically pleasing smile is very high. By that I mean you have more options of matching the colour tone and also the intensity of the colour to what you'd actually prefer.
So the advantage to spending what I assume to be quite a large amount of money is the appearance?
Well, as I said, they give a very natural appearance as well as the ability to select the colour tone of the teeth. But unlike composite restoration, the veneer is very tough to stain, so it gives you a long-lasting brightness. Also, the gum tissue tolerates the porcelain very well. Now, take notes on the disadvantages. On the downside, it's not a reversible treatment, and of course it is costly. So with this option, price has to be factored in. Veneers can also still experience some decay, and also some patients do experience some sensitivity to hot and cold afterwards. Now look at question 7. Take notes on Fiona's suitability for the treatment.
Okay, so apart from the cost being an issue, I think I'd prefer sensitive teeth than the ones I have now. Will they definitely work? I mean, will they stay on?
They'll definitely stay on so long as you don't bite any really hard surfaces.
So it will affect the way I eat?
No, I mean, try not to bite down on things like ice or, chew pencils, things like that. Just any type of really hard surface. Any type of actual food should be fine.
Oh, okay. Well, that's alright then.
Well, actually, I think veneers will be suitable because of the fact that you have otherwise very healthy teeth. There are no signs of decay or gingivitis, which is the disease of the gums I was mentioning earlier. You also don't appear to have any weakened teeth, and most importantly, there doesn't seem to be any sign of grinding. Now look at question 8. Take notes on dental care after the procedure.
And what about caring for veneer? Does it need any special treatment?
No, they don't actually require any special care. I would recommend that you start brushing twice per day, as I mentioned earlier. But also, do you floss?
No, never. I hate the feeling of it, and also the blood.
Okay, well, most people feel like that. The more you floss, the less blood will actually appear. You need to floss especially before bed and after meals, where you've eaten anything, stringy or where food is lodged in between your teeth. You can also add rinsing with a good mouthwash, just to give you that extra protection against tartar. And lastly, I'd recommend, although it's not absolutely necessary as the veneers are highly stain resistant, but I would recommend to avoid any food or drink that can potentially stain your teeth, things such as blueberries, red wine, and of course reducing your coffee. Now look at question 9. Take notes on the history of Fiona's chipped tooth. I should probably ask, how exactly did you manage to chip the tooth in the first place?
It's a stupid story, I think.
That's okay, I think I've heard a lot of them.
Well, I was trying to get the lid off a bottle for my son. I was in a hurry, and so I decided just to bite it. It was already a little loose, so I thought it would be easy.
And was it?
Well, no. Then the first attempt was a failure because I couldn't get the right angle, so I stupidly tried again, and this is what happened.
Okay, so how long ago was this?
Just a few months back, actually.
Okay. How old's your son?
He's almost 2.
Good. Well, we should try to get it fixed up, for any future photos then.
Yeah, I've kept my mouth shut in any photos since then, actually. I was really embarrassed. I don't think I have smiled in public since that day. I felt like an idiot.
Okay, well, I've heard a lot worse, to be honest. But look, if you decide to go with a veneer, at least you'll be able to smile in public and, of course, feel more confident again. Now look at question 10. Take notes on Fiona's concerns and the dentist's advice.
So, do I need to make my decision now? It's just that I'm still a little apprehensive just because of the cost. And to be honest, maybe also the pain.
Well, there's really no pain involved with veneers. There is a little inconvenience in the way of time. It'll take at least 2 further appointments, but the sooner you make your decision, the better, if you want it completed by the time you begin your new job at least. But what I'll do is I'll give you a brochure on not only the veneers but also other options that I've mentioned, and that way you can read through them at leisure and have a better understanding.
Yeah, that sounds really good actually. So the only pain is the cash.
Well, when you take into consideration that it will last a good 10 years, then the cost isn't actually that painful. And you can always wait until you've started working and received a few paychecks before we proceed. That's entirely up to you.
Okay, well, I have some thinking to do then.
Now look at question 11. Take notes on any further concerns and advice. Do you have any other questions at all?
Well, I'm still worried about the bad breath thing.
Well, look, as I mentioned, discoloration certainly won't give you any bad breath. I think cutting back on the cigarettes will give you a much fresher feeling and would have to make a difference with any odours. As I mentioned, improving your daily habits and overall dental hygiene, such as regular brushing, flossing and using mouthwash, will also make a difference. If you're really worried about it, there are particular foods to avoid, but to be honest, I believe that if you can manage to do those things I've mentioned, then you won't have any issue with. Occupational English Test. Listening Test. This test has two parts. Part B. In this part of the test, you will hear a talk on macular degeneration. You will hear the talk once only in sections. As you listen, you must answer the questions in the spaces provided on the answer paper. Turn over now and look quickly through Part B. You have 1 minute to do this. You may write as you listen, and there will be pauses during the talk for you to complete your answers and to read the following question. Remember, you will hear the tape once only, and you should write as you listen. Now read question 1. Question 1 has been done for you. Today's discussion is on an often misunderstood and neglected condition known as macular degeneration, and including those that it affects the most. The discussion centres on the more common and sometimes overlooked symptoms, as well as the known causes behind the condition. And we will also look into complications associated with the disorder and, of course, available treatment. Now read question 2. Now listen and answer question 2. Macular degeneration is a common eye disorder that causes central vision loss. A person's central vision is what they see when they are looking straight ahead. Peripheral vision, on the other hand, is what someone sees on the side when they're looking straight ahead. So macular degeneration doesn't actually cause total blindness because it doesn't affect the peripheral vision. Its prevalence, however, is on the rise. For example, if we take a look at just one country and look at its statistics, in this case the US, the figures are quite startling. It's estimated that more than 11 million people have the disease. However, globally, it is estimated that by 2020, 196 million people will have macular degeneration, and that this will increase to 288 million by 2040. It's also the number one cause of vision loss. Now read question 3. Now listen and answer question 3. There are two types of macular degeneration. These are dry and wet. Dry macular degeneration is the most common form of the eye condition, affecting about 85 to 90% of people with macular degeneration. This form of the disease often occurs due to small yellow deposits called drusen developing under the macula. This causes retinal damage and also vision loss. Wet macular degeneration affects about 10 to 15% of people with the condition. This occurs when abnormal blood vessels develop under the retina and macula. If someone has this form of macular degeneration, they may see a dark spot in the center of their vision due to blood vessels bleeding or leaking fluid. Now read question 4. Now listen and answer question 4. Macular degeneration is a progressive disease, which means that it will get worse over time. Those affected may not notice vision problems in the early stages of the disease, and sufferers are less likely to notice vision changes when it affects both eyes at the same time. The symptoms of dry macular degeneration are quite varied, and sufferers may notice a distortion of straight lines in their field of vision, or a reduction in central vision. They may find the need for brighter lighting or difficulty adapting to low lights. Blurriness is very common, as is experiencing trouble recognizing faces. Some symptoms of wet macular degeneration also resemble those of dry macular degeneration, such as visual distortions and reduced central vision. But there are some differences. With wet macular degeneration, people may experience a blurry spot in the field of vision. Some report to have hazy vision, as well as rapidly worsening symptoms. Wet and dry macula don't affect peripheral vision, so while the disease can prevent people from seeing what's directly in front of them, it doesn't cause complete blindness. Now read question 5. Now listen and answer question 5. Specialists know the cause of this disease as being the deterioration of the macula, which, as we now know, is a small area in the center of the retina in the back of the eye. But what isn't known is just why some people develop macular degeneration while others don't. Certain factors can of course increase your risk of developing the disease. For instance, being over the age of 65 years is a major contributing factor. Put into perspective, for those aged between 50 and 59, the risk of getting macular degeneration is only 2%. This jumps to almost 30% for those aged 75 years and over. Caucasians have a higher chance of developing the disease over other races, but of course this does not mean other races of people are immune. Also, having a family history of macular degeneration, smoking, and being overweight all contribute. And as with many other diseases and illnesses, having cardiovascular disease can also play a role. Now read question 6. Now listen and answer question 6. It is important to have annual eye examinations, even if one's vision appears perfectly normal, and the doctor should also be immediately informed about any vision changes noticed. Ophthalmologists can conduct a variety of tests to diagnose macular degeneration. For example, they can use special eye drops to dilate the eyes and then check the back of the eyes for signs of fluid, blood, or yellow deposits. During this test, once the yellow eye drops have been put into the eyes, the patient will be asked to keep their eyes open while a meter, called a tonometer, with a blue light measures pressure. The patient won't feel anything during this test. However, it is important the eyes are not rubbed in any way for 10 minutes after the eye drops are used, as it's possible that a person might inadvertently scratch the front of their eyes, in particular the corneas, if they are rubbed while the eyes are actually numb. Closing the eyes and dabbing them gently with a tissue is, however, fine, and will not generally affect the eye. During an eye exam, the field of central vision is also checked by asking the patient to look at a grid. If any of the lines on the grid appear faded or broken, this can be a sign of macular degeneration. Apart from this, there are other more invasive tests available. Now read question 7. Now listen and answer question 7. During what is known as fluorescein angiography, a coloured dye is injected into the vein into the arm to examine blood vessels in the eye. Then a special camera is used to take pictures of the eye. These pictures are examined with great scrutiny to look for any problems and changes in the blood vessels and retina. In another type of procedure, known as indocyanine, green angiography, a green dye, which is indocyanine, is injected. The test is very similar to fluorescein angiography and can also be used to confirm the results of fluorescein angiography and to diagnose your type of macular degeneration. Lastly, we have what is known as optical coherence tomography, which involves taking cross-sectional images of the retina and checking for swelling, thickening, or thinning. After a diagnosis is made of confirmed macular degeneration, the doctor may also use this type of test to see how the eyes respond to treatment. Now read question 8. Now listen and answer question 8. One of the complications of macular degeneration is being unable to perform certain tasks on your own. This may interfere with any number of daily activities as well as social interactions. As the disease progresses, it becomes increasingly difficult to drive, read, or complete other activities. Like many progressive conditions, macular degeneration has a strong psychological impact on sufferers and their family and friends. As a result of vision loss, about 30% of people with macular degeneration experience some form of anxiety or depression and commonly feel isolated from others, even close family members. Any symptoms of anxiety or depression should of course be discussed with a doctor, as they can suggest treatments to improve mental health, such as medication, counselling, or a support group for people with vision impairments, as well as lifestyle changes, which may also be a contributing factor. It's common for people with macular degeneration to be unable to drive a car. After a diagnosis is made, many may have to complete a driving test periodically to ensure you're capable of actually operating a car. Another complication is visual hallucination. It's estimated that 1 in 10 people with the disease experience visual hallucinations due to low vision stimulation. As your vision decreases, your brain may compensate by creating false images or hallucinations. It must be stated that this is not a symptom of a mental health problem and should be discussed with a doctor or support group, as they can help in ways to cope. Now read question 9. Now listen and answer question 9. While there is no actual cure available for macular degeneration, doctors can recommend and explain options to slow the progression of the disease. If you have dry macular degeneration, a low vision rehabilitation specialist can be of great benefit and expertise. The specialist can advise on ways in which to adjust and cope with vision loss. Surgical intervention may also be recommended to help improve vision, although this can be a very daunting idea for some. During the actual surgery, a telescopic lens is implanted into the eye, which magnifies the field of vision. For wet macular degeneration, a low vision rehabilitation specialist is also greatly beneficial, and working alongside and learning from the specialist is highly recommended. In addition, a medication may be administered directly into the eye to stop the growth of new blood vessels, but it may take several weeks of treatment before any difference is noticed. Another treatment option is photodynamic therapy. A medication is injected into a vein in one of your arms and then uses a special laser to close up leaking blood vessels. This type of therapy can improve vision, but may require multiple treatments. Photocoagulation is another therapy for wet macular degeneration. This involves the use of high-energy laser beams to destroy abnormal blood vessels. The purpose of this therapy is to stop bleeding and reduce further damage to the macula. However, the laser can cause scarring and leave a blind spot on the eye. So even if the treatment is successful, abnormal blood vessels can regrow and you'll have to return for another treatment. Now read question 10. Now listen and answer question 10. A downside to most diseases, both to the patient and to the broader community, is one of cost. Macular degeneration is expensive and will only become more expensive as the population aged 65 and older increases. So here are some costings for the disease. Estimates of the global cost of visual impairment due to age-related macular degeneration is $343 billion, including $255 billion in direct healthcare costs. Estimates of the direct healthcare costs of visual impairment due to age-related macular degeneration in the US, Canada and Cuba collectively is approximately $98 billion US. The global cost of vision loss due to all causes is estimated to be nearly $3 trillion for the 733 million people living with low vision and blindness worldwide. In North America alone, the direct cost for vision loss due to the all causes was $512.8 billion, and the indirect costs were $179 billion. So one thing is very certain: the sooner a cure is found for macular degeneration, as well as all visual impairments, the better. Thank you. That is the end of Part B. You now have 2 minutes to check your answers.